All right, so this is the hamstring stretch. For this stretch, you're gonna need one of these bands or the little square thing to pull back right here. Like most stretches, the parameters for this are going to be 3 times for 30 seconds. How you're gonna do this is you're gonna give this band to the patient. They can stick their foot through this little hole if they want, but they're gonna put it around the ball of their foot. And you're gonna have them lean back and they're going to lift their leg up, taking care to keep the leg straight. Just pull back until they feel a good stretch in their hamstring, that they really do need to keep their leg straight as they're going up, because when they bend it, they're not going to be able to get a good stretch in their hamstring. All right, so this is the figure 4 stretch. It's a stretch for your piriformis, which is just in the back of your glutes. So how you do this is you're going to have the patient lay down on their back and their knees are going to be up. You're going to have them cross their ankle over, and then they're going to pull back on their leg until they feel a good stretch in their glute over here. 30 seconds, 3 times. And if they can't pull back right here, you can give them a band or have them pull back on their legs. Same with the other version of the stretch, which we often use if laying down irritates their back or another part of their body if it gives them pain. So you can also teach them this way, where they're sitting up, they're going to cross their leg over and they can lean forward. This is the prone quad / hip flexor stretch. So for this stretch, you're going to give the patient a band like this. They can take one of the loops and loop it around their injured leg, the one they're going to be stretching. You're going to have them lay down in the prone position, and they can pull this band up and over. Sometimes it's easiest to do it over the opposite shoulder. So it's sliding out, and they're just going to pull back until they feel a good stretch. Hold that for 30 seconds, 3 times. If you're needing to get a stretch more in the hip flexors or a deeper stretch, if they're not feeling it, you can slide the opposite leg off of the table like this, and that helps them to get a deeper stretch.
So this exercise is called a Short Arc Quad, or SAQs, as you'll often see them on the chart. What you're gonna do is have the patient sitting on their table, and you'll take one of the round bolsters and place it under both their knees. And oftentimes you'll put an ankle weight around the affected leg, or both if they want to work out both. And you just have them straighten their legs like this, up and down, 3 sets of 15. And you just want to make sure that they're nice and controlled up and down and not letting their foot drop. All right, this next one is called straight leg raises, or SLR, as you'll see on the chart. What you'll have them do is be on their table. If their chart indicates an ankle weight, you'll have that on the affected leg. It's easiest if they kind of come down a little bit on their elbows or are laying down. They'll bend the other leg that they're not working out, and they'll just go up straight and then back down, nice and controlled. They don't need to come up too high, just until they're about equal with the other leg. And it's really important that they keep their legs straight the whole time instead of bent, because it doesn't work it out as much. Just 3 sets of 15 up and down. This next one is called clamshells. What you'll do is take one of these exercise bands and you'll place it around both the patient's legs right here above the knees. And what they'll do is lay down on their side, and it's important that they keep their feet together and on top of each other, as well as their hips right on top of each other. And they're just going to go up and down like this, keeping their feet together and not rolling their hips back. And they'll do 3 sets of 15. Another way that we'll see this is hooklying clamshells. Again, they'll keep their feet together, their knees bent like this, and they'll just be sitting up, going back and forth, 3 sets of 15.
All right, so these are quad sets, and we're gonna be doing 10 sets for 10 seconds. So what these are is you're tensing up the quads. Oftentimes this is the exercise where you can't tell the patient is doing anything. So if they have it on their chart, just make sure and ask them if it looks like they're not doing anything. What you're gonna do is you're gonna tense up the quads. One way you can help patients to visualize this is it's like you're trying to push your knees down into the ground. So you're gonna tense up as tight as you can. You're gonna hold that for 10 seconds and relax, and do that again 10 times. If they're having trouble with this, you can put like a little towel under their knees or something like a small bolster to help them, and just have them press that down into the table. All right, so this is the total gym. We often do heel raises and squats on this. So first off, how you work the total gym in Provo. In order to change the levels, there's a little like level thing right here. So you're gonna turn it the left to loosen it, and then you can lift this off and drop it down whatever level you want it on, and then you're gonna tighten it up again before the patient hops on. There are 10 different levels, 10, 9, 8, 7, etc. They're labeled. Often patients will start on 6 and work their way up. Megan's gonna be my patient. We're gonna do squats. So if you wanna hop on, Megan, okay? And then if you'll push up for me, you do that so you can unlatch this so they can get squats. All right, so what I'm gonna have you do is if you could place your toes up here at this line for me, and then feet shoulder width apart. And then I want you to sink down into a squat so you're getting a nice 90-degree angle. Right there is perfect. And then you're gonna push up again. And you're just gonna go and do that for 3 minutes. And we have a timer right here that you can press start for them. Also, a lot of times patients' knees will come in when they're doing the squats. So make sure and warn them about that. You want their knees to go straight down, not over their toes. And sometimes we'll give them a band to put around their knees to help with that. So another exercise we do on the total gym is calf raises or heel raises. So how you're gonna set this up is we have a little thing right here. You just pull this out, push this up. If you can move your feet down for me. And then you're gonna turn it sideways and slide this, and it'll like lock into one of the little holes. You start on like the second hole for beginners. And then if you'll place the ball of your foot right here on top of this, and then you're gonna sink all the way down so your heels touch the bottom, and then come up, making sure to flex that calf, and go back down in a nice controlled movement. And you're gonna do 3 sets of 15 with this. So to get a patient off of the total gym, you're gonna have them push up. So if you could push up for me, Megan, and then that makes it high enough so you can lock it back in right here. And then if you can slowly let down and it'll catch you. Perfect, and then you can hop off now. And feel free to offer a hand if it looks like they need it. A hand or
This next exercise is called heel slides, and we use it to help patients that need to work on their range of motion. So what we do is we get one of these straps and place it around their foot. Oftentimes we'll put a towel under their heel. If they're wearing their shoes, it just helps it slide better. And you just use the strap to slide the knee up until they feel a stretch, and they hold it there for 5 seconds and then can go back down, and they do that 10 times, just working on their range of motion. Next exercise is called wall slides, and it's another one to work on range of motion for our knee patients. What we do is we get a towel like this, and we have them lay on the table with the towel under their foot like this, and then they use their other foot to push their foot down until they feel a stretch in their knee, and they hold it for about 10 seconds, and then they can lift it back up and take a break. And we usually set a timer for 5 minutes and just have them keep going through this, trying to get a little bit more of a bend each time.
Yep.
All right, this one is called the prayer stretch, and we use this to help patients get range of motion in their knees. What they'll do is they'll kneel on a foam pad, and it's important that their kneecaps are kind of hanging over the edge so that doesn't put pressure on their kneecaps. And what they'll do is they'll just sink down, kind of trying to touch their butt to their heels. And when they get down as far as they can, they hold it for about 10 seconds, and we set a timer for 10 minutes. And after they've done 10 seconds down, they can come up and take a bit of a break. It's also important to remind them not to put all of their weight on their uninjured leg, because then it won't bend the leg we're working on as much.
Go.
All right, this is the Genubender, and we use this a lot for our knee patients when we're trying to get their range of motion back after a surgery or an injury like that. So what we'll do is we'll have the patient sit up here, and we'll put this bar in place by sliding it in here. It's a little tricky sometimes. And then you slide the other side in here. You have to push this button, and then it'll slide in, and then when you release it, it sticks into place. And then you have the patient start kind of winding it up. I'll bring it the other way. And you just help place this part behind their ankle like that. You'll place this towel over the front, and that just kind of helps from keeping their ankle from getting irritated. You snap this into place, and then you have them keep bringing the machine up, and you're gonna strap this one around the top of their leg, and you put this strap around it to keep this from falling over their knee while they're on the machine. And then you have the patient bring their leg as straight as it will go. It's going to be different for each patient. Okay, once they've got it as straight as they can go, you'll find their name on this machine. Each patient that we have here that uses the Genubender will have their own kind of account. And you'll put it on. It'll be set for 15 minutes, so make sure you put it down for 10 minutes. So then we'll have the patient hold it up here for 10 seconds, and then they'll crank it all the way down as far as they can bend it for 10 seconds as well down here.
Go ahead.
The important thing for this strap is it keeps them from lifting their hip up, because that can be cheating in a way when they bring their leg up straight, and then it helps them get a little bit more of a stretch during extension. All right, so when you're putting this in, you'll put this end right here through this hole. It can be kind of difficult sometimes to get it in. So that slides in, and then you bring this side over, you push this down, and it should be able to slide right in, and when you bring it up, it'll click it into place. Okay.